Everyone needs to watch this. There's a new epidemic in our healthcare, and it affects both adults and children, and it's going to blow your mind. It's considered a silent epidemic because you don't know about it, policymakers don't know about it, and global health community doesn't know about it. But that hasn't stopped it from messing with your health and becoming one of the major risk factors for the leading causes of death and disability like cancer, diabetes type 2, and cardiovascular diseases. Make no mistake, it's on the rise and it's rising quickly. And it's non-alcoholic fatty liver disease. You know that thing that we used to only talk about in regards to alcoholics? Well, they're now starting to find it in adults and children who have never had a drink of alcohol. It's happening because of the modern food environment we're in and the misinformation we've been given about what's healthy for us to eat and drink. It's so important that about 30% of US adults are suffering from this, and even 10% of children. So yes, 30% of adults and 10% of children, but that number goes up if children are obese. In obese children, it can be up to 38% of children. But why does it matter? Because the liver performs over 100 different functions for us, and when it's not doing well, we start to get seriously sick. And that overworked liver is a leading factor in why so many women and men are having gallbladder issues and having to have their gallbladders removed. When the liver is sick, the gallbladder is sick. That's just one. So what's causing it? Sugar. We should only have about a teaspoon of sugar in our bloodstream at any given time. Any more than that, and the body goes into emergency mode, sending out insulin to carry it and deliver it to areas where it can be stored. The liver is one of the places that it stores it, and it can only hold up to about 100 grams of sugar, and then it starts to have problems. Fruit juice is a major problem. Think about that orange juice, that apple juice that you're giving to yourself, your kids, your grandkids, thinking it's a healthy option. It has 20 to 30 grams of sugar. Those healthy options of granola bars and Raisin Bran, well, they're more high in sugar than you would suspect. Not to mention the snacks that we already know are high in sugar: cakes, cookies, muffins, and candy bars. Kids' cereals are about like giving your kids candy for breakfast. With all that added sugar and the liver struggling, liver cells start to be replaced with fat cells. And when that happens, chemicals start to be released that cause inflammation and a number of other problems. So you start to struggle with cholesterol levels. Your triglycerides are going up and you start gaining weight. All that excess sugar means your need for insulin is growing, and that cues the body to store visceral fat. That fat around the midsection. So if your belly is growing, you're probably insulin resistant and you're likely suffering from any number of other related symptoms. So here's what you can do. Understand that the food that we're getting is very different from the food that our body needs. Things have been modified to help them grow faster, quicker, bigger. Our soil is being degraded because we're not rotating crops. All of this leads into the fact that our foods have less than 50% of the fiber that they used to have, and that's what slows down the delivery of sugar. So we need to make sure that we're getting proper fiber in our diet, regardless of whether you're eating organic or boxed. For many of us, it's just unrealistic to think that we're going to get the proper amount and types of fiber in our diet daily. I choose to supplement. Whatever you choose, just make sure you're getting in those proper amounts of fiber to help safeguard yourself from things like non-alcoholic fatty liver. Fiber is just too important for us to not get in daily. So even if you don't need this right now, someone that you know probably does. So share it with them.